We saw a lot of predictions in the early weeks of the pandemic that it would result in wholesale closing of practices or selling of independent practices to hospital systems. Has that been happening?
I have not seen that many practices being sold off to health systems or hospitals, at least not in my experience. And we've got clients coast to coast. So I haven't seen one practice that is sold out due to the pandemic. I have seen practices close permanently. And as I stated earlier, we've got practices that are still temporarily closed and or operating at some semblance of what they used to do. For the most part, the practices that have closed are those that either weren't able to get funding, stimulus funding, or didn't have the resources in order to keep the practice going, or just finally stated, hey, I'm close enough to retirement, I'm going to be done. I've got a derm practice out in the Midwest that's been closed the whole time. Physicians on unemployment, pretty much hasn't even, I haven't even been able to contact him in the last 3 or 4 months.
Wow.
So he's not responding to emails, phone calls, things like that. So I don't know the story there, but again, it's going to be dependent upon the wishes and the concerns of each individual owner, physician.